spider veins and how are they treated?
Spider veins are tiny blood vessels that occur in different parts of the body. They occur primarily for genetic reasons. We see them primarily in the legs, and we'll see them in the face as well, very often associated with rosacea, for example. So there are three classes of veins in size. They're the big, thick varicose veins. They're the skinny ones that are almost as thin as a hair. Those are the spider veins, which are on the surface. And then the ones in between, which are called reticular veins. We use a laser for our treatments, and the lasers are specifically designed to treat spider veins. So these are the ones that are, as I said, are as thin as a hair, and they're on the surface, and they tend to be either red or purple in color. What's going to happen there, the laser is going to penetrate through the skin. It will absorb into the red blood cell that's in the vein itself. That blood cell will superheat. It will collapse the vein. If there's no vein, there's no redness, and that's how that problem is removed. What's also important to realize that these veins are not essential. So if we remove these spider veins, there's going to be no negative sequelae to the patient. So that's also important for patients to realize.
How many treatments does it take, and how many weeks apart are they?
The treatment protocol for the spider veins, usually the treatments are performed roughly every 4 weeks, and we tell patients anywhere from 3 to 4 treatments is what they're looking at in terms of their treatment course.
What skin types can you treat that do have spider veins?
Patients with spider veins with the skin types 1 to 3, which are the lighter skin types, are the ones we can use with the laser, simply because we're using such massive powers with the laser. If you have a darker skin type, unfortunately, that laser energy is going to absorb into the skin and will burn the skin before we are able to collapse the blood vessel. So it's not practical to do it on darker skin types. We have a nanotechnology, however, that allows us to treat the spider veins in the darker skin types, which is also successful.